Okay, so what is cold plasma? It is more correctly termed cold atmospheric plasma, which is an ionized gas that has only been recently extensively studied by researchers as more of a possible therapy in dentistry and oncology. There are very few studies out there that have been done on aesthetic applications for plasma. When I say we are pioneering this field, we are truly pioneering this field. So it's really exciting. Plasma for aesthetics is still fairly new. If you are an esthetician and you're in the industry, you've been hearing about this for a few years, but mainstream hasn't really caught on to it quite yet. So there aren't any huge studies that have been done on plasma for aesthetic purposes yet. So what we have are our personal experiences, our before and after photos. That's what we have right now. Today, we're going to get more into the cold plasma. So, there are several different gases that can be used to produce the cold atmospheric plasma. Helium, argon, nitrogen, just air that you breathe can be used, and then something called heliox, which is a combination of helium and oxygen. For PLAXEL purposes and most of these plasma pens, PLAXEL is ionizing the atmospheric gases, so basically oxygen. Oxygen is a combination of several different gases in very small quantities, but essentially it's using oxygen to ion and produce the plasma discharge. Same technology in the pen is producing that cold plasma. We'll get into how it changes in a second, but in a nutshell, that's what cold plasma is. So what makes something true plasma is there's a few different factors you want to look for. You'll see the purple spark. If you're using the needle tip, it'll be a true violet color, not yellow, not orange. It's violet. And you'll smell ozone from that plasma discharge. You'll actually feel the plasma energy enter the skin, not just burn the surface. It does feel very different. If you tested different pens on yourself with Plaxel, you know what I'm talking about. You actually feel it enter your skin. And the other thing to look for are those white dots. And that's how you know that the plasma is true plasma and it's targeted and it's going where it needs to. This needle tip with the Plaxel, what it's doing is it's pushing away the stratum lucidum and stratum corneum, which are the top two dead layers of skin cells on your skin. Those are the two layers that don't have any moisture left. So the plasma is plowing through those layers and getting to the cells that have some moisture left in them and sublimating those cells. So with Plaxel, we're essentially deleting a few skin cells at a time. And when you work on that really creepy skin, and you're able to get a video like zoomed in of you working on that skin. And if you have really good eyesight, you can see this, but I find I have to zoom in sometimes to see it. You'll actually see the skin tighten just a little bit every dot that you put down. It's really cool. Sometimes you will see that effect with a skin burning pen because it's just burning. And when you get a burn, you get tighter skin. So that's not necessarily an immediate effect. It's not. The true results come months later after the person has had a chance to produce the collagen and elastin. People that are posting these immediate amazing results, that's really just inflammation. I don't care what device you're using. Some people will start to see results in a couple of weeks if they heal really fast, but generally you're waiting 2 to 3 months for those final results. Does cold plasma tip need to be replaced if there's a certain period of time? Yeah, so yeah, it doesn't have to be replaced unless you find that you just can't clean it anymore, like it's stained or something. I haven't had that issue, but I would not put it into an autoclave. It could damage it, but you can clean it with alcohol. You can clean it. I wouldn't soak it for too long in barbicide. It can discolor it. I always clean mine with an alcohol wipe and make sure I get into the little crevice. I make sure that I get into this little crevice. I have these tiny little alcohol wipes and I'll just make sure and clean it really well. You're not going to be getting it soiled with blood, so you don't need to worry about sterilizing in the true sense of the term. Yeah, so the cold plasma tip, you can use it unless you drop it and break it, then you'll need a new one. P3, some of you guys feel that P3 is too strong. It really depends on your client and their comfort. So if P3 is too strong, you can turn it down. You can mess with the frequency. You can use it on continuous mode. Safe to use an enzyme in your facial. Yeah, it is. Just when you're actually using the cold plasma tip, you want to make sure there's nothing on the skin. Cold plasma can be performed as often as you want. It's not leaving marks on the skin, and it's going to stimulate collagen production. You can actually do it as often as you want to. Needle tip, different story. I would not repeat in the same area for 3 months at a time. Is there a client concern you would use cold plasma for over the needle? Yes, those who have darker skin, cold plasma is better because it's not going to produce any hyper or hypopigmentation. If people don't want the downtime of the needle, that would be a good way to introduce the cold plasma tip because the needle tip, of course, has some downtime to it. The cold plasma is not painful at all. If you have people that are super scared of any kind of pain or they just don't numb well, cold plasma would be a good alternative. Yeah, you can use a cavity wipe on the cold plasma tip. You can do that. How often? How many treatments? You can do it as often as you want. If you're going for face skin lifting, I would do at least 6, but you can also just incorporate it into every facial just for the purpose of infusing the active ingredients deeper into the skin. Seeing in another group that they are claiming the cold plasma or the device they're using is helping with wrinkles. Is that true? So it can help with wrinkles if you do it enough. It's going to take a lot of sessions to see a noticeable difference, but that's the whole reason why we're doing all of this is to minimize wrinkles. If you are able to get a lifting effect with it, then yes, you're going to help reduce wrinkles. But again, you're going to have to do at least 6 facials to get that lift effect with it, which is why I like the dot plasma a lot more because it's quicker. And yeah, the cold plasma is not painful at all. And you could do it every day if you wanted to. Yes, you can use it on crow's feet. On flaky skin, yeah, you can. You would want to use a very good moisturizer afterwards, and it will help the skin absorb that moisture a lot better as well. I'm going to have you guys look at Laura's skin real quick so you can see where we did a couple of different things. You can see where we did, you can barely see it on the screen, but we did her dots under her eyes. And then we did this dragging on the top, which is going to peel. So if you're going to do the drag technique, their skin is going to peel. So they're not getting the dots and the crusting, but they are going to peel because it is a thermal application. But you can see that she's got the makeup on top of it, which covers a lot of it until they start getting flaky. Then, of course, it's going to look flaky no matter what. But it covers all the redness. While I'm connecting my phone, I'm gonna have her tell you about the carboxy mask. If some of you guys were on that call, you know what I'm talking about. But it's another really great tool in the healing process. So I'm gonna have her talk about it for just a second.
Okay, so we decided to try the carboxy gel treatment to see if it would speed up the healing with the plasma. So immediately after doing plasma, I put the carboxy gel treatment on for 45 minutes and it took away the redness. As soon as I took the mask off, my face was no longer red. I also feel like my dots have dried out faster this time. So it seems like it's speeding up the healing because we did this on Tuesday, I
Uh-huh.
think, and it seems like my dots are gonna start falling off already, and usually it takes me a good week before they fall off. And then after they fall off, we will do some more treatments with the carboxy mask, like every 3 days until we've done 4 masks, and take a series of pictures to see if that helps plump it up more, enhance the treatments of the plasma, because we've done plasma on my face and on my eyes 4 times now. I think. So
Yeah.
we know how I react and what the results are. So this will be a really good experiment on how well the carboxy mask helps the healing and enhancement on the plasma.
All righty, cool. Okay, I am going to. Did you apply carboxy gel with alpha hydroxy acid after needle plasma?
Not just the
No,
carboxy mask, the
just the
carboxy.
carboxy mask. We're gonna see how well she responds to doing the lifting technique. We're gonna do that on one side of her face. Then we'll sit her up and see if we notice a difference. Some people will have, again, an immediate difference. Not everybody will. You can either hold the button down, get your finger tired, or you can hold down this joystick here. And you'll see that the display goes light, and then you push that trigger button, and then you'll get this green light that stays on. that means that you don't have to push the button anymore. It will just discharge. So if you have a needle in there, be really careful 'cause right when you get close to something, that plasma will come right out. When I'm doing a lifting facial, I like to incorporate the neck. Some people like to upcharge for that. I like to incorporate it because they're just going to be happier. And when you drag this across the skin, you want to make sure it's dry, but you're also going to drag it and hold the skin with the other hand so that the skin is taut. Can you feel that?
I could say you're dragging it.
See, I can feel it vibrating. And this is where you'll just experiment with different
I can
settings.
feel that now.
You felt that one? Okay. So for her, I have to make sure that skin is very taut. I'm going to slowly drag it across. I'm going to do 2 to 3 passes on each stroke or each area that I do. You don't want to apply a ton of pressure. You just want it to be very gentle. They always go in an upward motion. And it's very relaxing. They'll feel a little bit of vibrating and you'll smell ozone. You smell ozone? Yeah. The base should feel a little bit of a vibrating, and you will also feel it from holding the pen, and you'll feel it in your other hand where you're stabilizing. Again, I'm going to do 2 to 3 passes on each spot. Since I'm not able to do her entire face, I don't know how much lifting we'll see, but we're going to try it. Is there any sound from this pen with this tip? No, I don't. Do you hear any?
It has a little bit of a buzzing.
Little bit of a buzzing sound,
It's very low though.
a very low buzzing. I can't hear it because I'm deaf. Like I'm literally deaf. But she's telling me that she can hear very low buzzing.
It's mostly when it gets closer to my ear. It's like when she's over here, I don't hear it very much.
I'm just doing a little bit extra because I don't get to do the rest of her face because we already plasmaed her face the other day.
Keep me young looking. Keep me young looking.
Yeah, that's the goal, right? So after I've done this direction, I like to do another upward lifting direction. So I'm doing kind of a crisscross pattern. And hopefully this gives you guys an idea of how long it would take to do. It's really not super long. Doesn't take a long time to do the whole face. You see me like start and stop a little bit just because like I'll stop feeling the vibrating and then I want to make sure it's still vibrating.
Rachel, we had a question who was asking how long after using the needle tip can you perform a cold plasma treatment?
You could do it as soon as the dots fall off. Good question. I know some people that will use the cold plasma tip and drag it across the face quickly before they apply numbing to help the numbing penetrate better. The numbing I use is TKTX, and it's so good that I'll just massage it and scratch it into the skin, and it works super well. Laura here has had an electric device treatment before. It was a lot more painful, right?
Oh, yeah.
So Deborah's asking, how do you incorporate the cold plasma with your hydrofacial?
With hydrofacial? Wow, that's
Yeah.
a good question. I haven't even done that yet, but you could do that right before you do the booster, but you would have to make sure to do it after extractions and get any serum that's on the face. If you're using the glycol peel, you got to make sure you really get it off the skin and dry the skin before you do the cold plasma. And then that's where I would do it, is between extractions and any other serums that you apply. Alrighty.
Another question we had is how much do you recommend charging for a cold plasma facial?
So I charge, let's see, I do 195 for an hour and a half if I'm including the cold plasma. I call my facials custom facials because I just make them custom to each person. But if I'm incorporating the cold plasma, I'll do it for 195 for an hour and a half. Okay, let's have you sit up. Let's see if we notice anything. I'm not sure if we're going to notice any lifting because we only did a small portion, but we'll look. Check this out. Look out real quick. Without turning your head. Just look straight at
For
me.
my body.
Yeah. So do you notice a very slight difference? Not a ton, but I haven't done a lot of cold plasma on her. We've done mostly dot plasma because that's what we've been testing the most. But I gotta get right in front of you. Yeah, so I noticed a tiny bit of lifting right in here versus the other side that we didn't do, especially on the neck. Just a tad. But after this, I would put my active ingredients on so that she'll get the most absorption from those ingredients. I'm going to show you guys the technique that I use most often for infusing products. So go ahead and lay back down. Get some vitamin C serum.
That's some good stuff.
Yeah. Okay. Yes. So the one that I really is Sunshine Botanicals. It's called Brightening Moisture Fluid. And this is a vitamin C. She now calls it vitamin C plus brightening moisture, something like that. She changed the name to emphasize the vitamin C. So when I'm purposely using this to infuse products into the skin, I like to do one little section at a time. So I will do like just over here, for example, do a little circular motion. Make sure you're feeling the vibrating, smelling the ozone. You feeling vibrating a little bit? Do this small section. And then a little bit of my serum. And then I will do another section. You want to be careful not to get serum on your tip. and I'll do that all over the face. Some people like to draw a grid. I don't. I can just tell where I've gone. But if you like to draw a grid with a white eyeliner pencil, you can do that. I also don't do that because I'm trying to keep their skin really clean while I'm doing this. And also, I was going really slow on that lifting. You don't have to go that slow. You can go faster. I just like to be very relaxing in my movements because all my facials are super relaxing. I incorporate massage. So I'm used to moving a little slower. But
So we had a question.
yeah,
Does the cold plasma tip help with refining the skin with acne scars?
I would use a needle tip for that. I don't think cold plasma is powerful enough, in my opinion. Maybe after doing several sessions, but I would much prefer to do the needle tip for that. But you guys get the gist of how this works. So maybe set up one more time. Yeah, I noticed even more improvement after adding the serum in. I don't know if you guys can tell, but I can see it in person. But that'll be even more dramatic the more that you do. So these cold plasma facials are really going to build on the previous one. So each time you do one, it's just going to be better and better. It's like the same reason I do cryofacials. Each one builds on the previous one. And there are some people they like to do packages of custom facials where I incorporate the cold plasma with cryofacials. And for some people, I like to incorporate microchanneling with it. It just really depends on the person. I talked a little bit about incorporating different types of treatments and red light therapy inside of our online training. How far in between to get results? 2 weeks. Yeah, if you want to see some good results with the cold plasma facials, I would do them 2 weeks apart. What I really like to do is I like to get people on this plan of come see me once a week for the 3 or 4 weeks, and we'll see how they're doing as we go along. But when I first get started with someone, I want them to come see me every week for at least a month so that we really ramp up that collagen production quickly. And then we'll taper off to every other week. And then eventually we go to once a month for maintenance. That's true for my cryofacials and my cold plasma facials. If we do microchanneling, that I always do that 1 month apart, every now and then 3 weeks, depending on how aggressive we are. But I do like to gear people up to doing the needle plasma. I don't like to jump into that as my first line or my first treatment with people. I like to get their skin ready first. Any minimum time before or after ProCell? Yeah, you could do cold plasma like the day before you did ProCell if you wanted to. Um, Afterwards, you just want to make sure their skin is not sensitive anymore. And then you could do another cold plasma facial if you wanted to. If you're just doing like a 0.25 a couple of days later, it's probably fine. If you're doing a 0.5, they might need 3 or 4 days. If you're really sensitive, you might need 5 days. But as long as your skin's not sensitive, you can do another one. I want to make sure it was anything. Have I tried full thighs and legs? Not with cold plasma. I just do that usually on the face. I feel like we would need a more powerful device with a bigger tip. And I say more powerful because your skin on your body is just thicker. It just needs different things. Erin has been finding that the ball tip has been great for keloided acne scars. So that's really cool. I haven't experimented with that. That's something that is so cool about this community is we have like Erin, who's a nurse. We have nurses, we have nurse practitioners, we have doctors, we have PAs, we have so many different kinds of people, lots of estheticians, lots of medical estheticians, lots of people using this device and discovering new things all the time. But our students are finding out some crazy awesome things. And another example is I've always said, don't work on tattoos, don't work on permanent makeup with plasma. It's not what it's for. But I had a student recently who removed a couple of hair strokes on some microblading. And she was successfully able to remove a couple of little hair strokes that client didn't like. So that was amazing. I would normally tell you not to do that, but she had success with it. And maybe it's because that pigment was very superficial and the plasma acted more like an exfoliation type of treatment? I'm not sure. So that's just something we have to explore more. Again, we are pioneering this field of true plasma. So it's really exciting to be one of the first to get involved with this, especially with PLAXEL, because we do know that it is true plasma and it does these things that true plasma is supposed to do that we're all told that it's supposed to do. You guys have seen my masterclass. I talk about that, how when I got started, I was given a device that just burned the skin. And I was so disappointed because I was told one thing and it did something completely different. So that set me on my journey. Ended up buying a Plaxel, and that was before the true plasma version came out. I think it's funny that I trusted the manufacturer a second time, knowing that the first device I bought from them was not really true plasma, but they upgraded to true plasma. I bought another one. And as I was filming a training, I was literally working on an orange and filming it with the new Plaxel, and it wasn't doing the same thing as the old one. So I started working on my skin and I was like, oh my God, this is so different. I have to reshoot like half of my training now. And I had started my training because I had so many requests for people that needed good plasma training. So that's why I originally started it. And I was like, oh, I'll just figure this thing out as I go. And then I got this true plasma pen and the rest is history. We recorded a lot of that training and that's what you guys see when you log in. And for those of you that are students and you haven't seen the extra video section of training, make sure you go look for that. If you don't have access to it, please let me or Mike know because there's so much additional videos in there, extra techniques, and extra training. Anytime we discover something new, that's where it goes and you get free access to that. Those of you that aren't students yet, that's how it is. I don't charge extra for extra training unless it's hands-on. That's different. We have a group of amazing trainers now all over the country and we don't have a trainer in every single state. So if you're interested in being a trainer, reach out to me and we can talk about that too, because I'd like to have one in every state eventually. But with that said, the online training, anytime I add to it, you have lifetime access to it. So you don't have to pay extra for that ever. And we try to, again, keep our costs down low so that everyone could have access to this true plasma. And Megan is saying that, I'll read this out because it's such a sweet compliment. And I love it when I hear this because it helps me to know that I'm doing something right. And I really want this to be the best training in the world. I really want that. It's my goal. Megan is saying, you're doing a phenomenal job based on other training I've received. You have surpassed the expectation with your professionalism and your availability and encouragement. Keep up the great work. Thank you. My students know that I will answer my phone even if my kids are in the bathtub. And I use that example all the time because I have literally done that. I will answer my phone even if my kids are in the bathtub and I will answer your questions. I work late at night. Anyone that's got questions can always ask me. I'm talking to people in the UK a lot. We're in different time zones.
Just a quick question. I've been working with the Monster and I've been having issues with it. Tell me if you have any experience with the Monster, then what would you compare it to the Plaxel? Mike has been calling me a lot and sending me emails and he stopped for a while, but I'm looking into because I was wanting to try the Beauty Monster first. So tell me if you have any experience, if you can tell me what have you found it to be. And I'm not trying to do a comparison, honestly trying to provide a better service for my clients.
Gotcha. Yeah, I don't personally have a Monster and I have not worked with it. The videos that I have seen with it show me that it is an electric pen and that it's just doing the burning dots. So that's very different than what Plaxel does. So I don't have tons of advice on that specific device. What?
No, it is usually that's what it is. A lot of people don't tell you because they're scared, retaliation. But you working with so many people, at least giving me an idea that there are some issues. And I'm looking forward to seeing if I could work with the Plaxel. Still looking at your training. I love your vibe. You give me such a zen feeling. So I love it. Thank you very much.
Oh, you're so welcome. And feel free to just reach out to us, get in contact with Mike, and he can get you in touch with me if you want to talk more on the phone. I'd be happy to get on the phone with you and answer more questions.
I'm truly interested how often do you recommend to do cold plasma? You said you recommend in the beginning every week, like 3-4
Yes.
times, and after this repeat every month. But
So it depends on how your client is responding, how their skin is responding to it. So if you start noticing some drastic improvement after doing it 4 times every week, then I would move to every other week and do maybe 2 or 3 of those every other week, and then skip to once a month for maintenance. But really just watch your client's skin, see what it's doing, if it's responding, if it's not, and then just change your technique accordingly.
I have a training. I did, I'm sorry, my English. I have training for blood, and they recommend to do it minimum 6 months apart. And also, I specialize in an anti-aging treatment. Mostly women, they have loose skin. Does cold plasma help with this?
Does it help with what again?
Loose skin,
Loose skin.
aging, especially like neck. It's really big problems with age is the neck.
It does help with that, but the dot plasma with the needle is way more effective for that.
30. How many shots? Okay, if you use needle, how many shots you do? Oh, a lot that you can do on some spot.
On sunspot, cold plasma?
Yes, because I see some pictures. It was like practically covered with spots, and it's received for months. It's not.
Yeah,
it's-
I generally like to do the needle tip on the sunspots to treat them that way.
Can
Some
they
of
see
them, some of the sunspots, depending on if they're deep or superficial, the really superficial ones come right out. But if they're a little deeper, they may take a few treatments before they resolve.
Okay, thank you.
You're welcome. And what exactly does this do? Stimulate collagen? Yes. Cold plasma is helping to stimulate collagen. Yes. The numbing that I use is called TKTX, and you can find it at worldplasmashop.com. That's the numbing that I use. Just be mindful that it is not legal everywhere. I'm in a med spa. My medical director is okay with it. So
And
just
as-
make sure you
as-
check on that.
And as far as your aftercare, like the aftercare, you guys are thinking about making maybe a line for aftercare, something the formulation wise would work specifically. I would be excited about a bundle.
Yes. So we partnered with Sunshine Botanicals, which is my personal favorite skincare line right now. Sunshine Botanicals has put together a wonderful aftercare kit for us. Those can be, I think they can be purchased on the shop site. I can't remember. Yes, they can. They're there.
Okay, great. Thank you.
Rainforest.
I will look at it.
Also, if you want to get them cheaper, then I'll need to get you in contact with Sunshine Botanicals and they can offer wholesale pricing. I can't offer that, but they can. So I can, if you need that, want that, get in touch with us and I can get you connected with them.
Awesome. Thank you very much for the partnership. It's important, you know.
Yeah.
But the problem is everybody wants to get in it, but not everybody, have the knowledge, certification, experience. And I'm just happy that you're able to provide that. Thank you.
You're so welcome. Oh, got a question about the tyrosinase inhibitor that I like to use to test the skin of the client. Okay, so I only use the tyrosinase inhibitor if they're above Fitzpatrick 3. I will automatically use it. Some people use hydroquinone. I don't like that because hydroquinone poisons the melanocytes and we're not trying to poison anything. So I really like the Anti-Age brand, their brightening serum for pre-treating. And for some post-care, for some people will need that too. I especially use it on those that did not react super well to the spot test. So I do a spot test this is all with the needle behind the ear, and I'll do a significantly high power, probably 7 or 8. And I'll do several little dots behind their ear. And we do it there just in case they scar from it. And then it's in a place where nobody's going to see it. It's not on their face. So I spot test everyone, even my Fitzpatrick ones. Some of them are prone to hyperpigmentation and they don't know it. Most of them do know it, but I spot test everybody. So if they do give you a little bit of pigmentation issues after 2 weeks of healing and it's not significant, then I'll do the tyrosinase inhibitor with them. I'll have them use that for 3 to 4 weeks and then we'll do the treatment. And then once the dots fall off and they've used all their aftercare, then I'll have them do more of that brightening solution just in case. But if we do a spot test and it is like very apparent that they hyperpigmented or hypopigmented, they're just not a candidate. I won't touch that. It's just too risky. So hopefully that answers that question. Megan, I'm surprised at how many practitioners do not spot test. I am very surprised too. I really harp on this to spot test every single person, even if they are Casper white. You just don't know. And a lot of people don't know because they don't get a lot of different skin treatments. So they don't know how they're going to react. So spot test every single person. I talk about that in my training too. But Maria, you're so welcome. So did anyone else have any other questions? I really hope this was informative. I am tired, so I know I was probably jumping around everywhere. but I think I got everything in that I wanted to. How long before you spot test? Not sure what you mean, but I will do a spot test. If someone's interested in plasma, I say, all right, let's do a spot test. Do a spot test, and I'll wait at least 2 weeks and check it out and see how it healed. And then we'll decide whether to continue or not. Hope that answered your question. But again, I like to do some other treatments before I do plasma just to really ramp up their collagen production, get them in a state of healing before we do plasma because it is a little bit more aggressive. So I want to make sure they're fully prepared for when we do it. I also have them take some extra vitamin C, and I also like beauty blend supplements sometimes. But with the other one, arnica, having them take arnica 2 weeks prior and vitamin C is a perfect combination to help the skin heal from within a lot better. Thank you, Claudemar, for being here.
Are we going to
And,
follow up with emails to all of us with some further information from you and your class? I'm just eager to receive information.
Yeah, if are you wanting more information about our device and training?
Yes, all of the above.
Okay, yes. We'll send out another email as a follow-up. Absolutely. And for Fitzpatrick's 5, is it safe in middle plasma? So the higher Fitzpatrick, I would not do the needle tip past a light, like very light 5, and that's with they pass that spot test with flying colors. Ball tip and cold plasma tip are safe on all Fitzpatrick. Okay, we've been on here for a while, so I'm going to say good night. And if you have any other questions, please get on worldplasma.com if you're not already connected. Enter your information, and Mike will get with you, and he can schedule a phone call with me and you as well. If you guys want to talk on the phone with me, I'm totally open to that. Thank you all again for coming on tonight. Have a wonderful evening, and we will chat soon, I hope. Bye.